Hello, everyone. I'm from the University of Bristol in the UK, and we're discussing 2 cases of embolic pneumonia secondary to udder cleft dermatitis in dairy cattle from the same farm. I should fess up at this stage, while I'm in the emerging diseases stream, you may recognise the phrase udder cleft dermatitis, and that is because it is a well-recognised pathology, and I'll go into talk about that in a minute, but we at the University of Bristol, through our pathology service particularly, but we've seen these cases through our first opinion practice, are presenting in new ways with new fatal process. And so I'm just going to give a summary to start with of just what is udder cleft dermatitis for those of you less familiar with it. I'm going to go on to discuss the presentation and the management of the couple of cases that we've seen. The post-mortem examination results, have some nice gory photos for you, and then some questions, which are actually questions that I am posing to you guys, because I'm here presenting this, wanting some understanding of what other people are seeing out there, and maybe you're seeing it in other countries, maybe not, and then some conclusions about what can be learnt maybe from some of these cases. Before I say this as well, I should also give credit to the pathologist that I work with, who is Mick Miller in the University of Bristol Pathology Services, and he gave all the pictures and some of the data for this presentation. So udder cleft dermatitis is a condition that affects the skin cranial to the udder on the body wall of the cow. It's also known as ulcerative mammary dermatitis or intertrigo. It is recognised in many countries and by farmers and vets alike, and there's just some pictures there, so it can go all the way from just some small area of hair loss all the way through to these open ulcerative lesions on the cow's body wall. It has been thought to be non-production limiting. Farmers complain about the foul smell that comes from these lesions, but when you touch them or try to sort of deal with them, they do seem to be painful, so it's likely to have welfare implications for the affected cows. It has been reported that they can have other sequelae, including abscessation and rupture of the adjacent milk vein. And just recently I've heard of a case of that happening in my local area where I practice, on a farm that I don't deal with. And also clinical mastitis can apparently happen in occurrence with these lesions. So I don't think anyone's really got a handle of what is actually causing these lesions yet, as far as I'm aware in the literature. Various hypothesized causes, including spirochetes, treponemes, and Fusobacterium necrophorum as an opportunistic bacteria. And then there are also some papers in the literature citing possible associations with sarcoptic mange in cattle, udder conformation, udder edema, and many other hypothesized sort of associations. So just to give an idea of the case background of the 2 cases that I'm presenting, they both happened on the same farm in 2016, one in February, one in September of that year. Both cases were attended and managed by first opinion vets from the University of Bristol Langford vet practice, and both cows went on to have post-mortem examinations, so the clue is that they didn't do that well. So an idea of just the farm background, where they came from, because it may have some implication into the etiology of the disease. This herd is a 200-cow pedigree Holstein herd, milking all year round, 3 times a day milking and reasonably high yields of 10,500 litres. The cows are run as 2 groups according to milk yield, and they are housed all year round in deep sand-bedded cubicles. I took the photo there as an example of how nice the cow comfort is on this farm. So I think they're pretty nice cubicles. And because there is this suspicion of association with treponeme spirochetes, it might be pertinent to know that the herd is endemically affected with digital dermatitis and does get sporadic cases of interdigital necrobacillosis as well. But that's being controlled pretty well on the whole by foot bathing twice weekly with 3% formalin. And then we did some digital dermatitis scoring in December of this year, in 2016, which indicated a herd prevalence of 33% of digi lesions, with 10% of those being active. Probably on the farm, digi is one of the primary causes of lameness, which is otherwise pretty well managed. So, description of cow 1. That is probably not cow 1, but is a cow on the same farm. She was a 6.5-year-old pedigree Holstein cow in her 4th lactation. I should say she was about mid-lactation when she presented. She was dyspneic with increased lung noises, particularly on the left lung fields. She had a slight tachycardia, poor rumen fill and decreased rumen turnover with dehydration. She also had milk drop, as you can imagine. So a sick cow with respiratory signs, but she actually was non-pyrexic at the time of presentation. She did have some blood work done. As you can see, probably the most pertinent things would be the neutrophilia with bad neutrophils and the lymphopenia, so suggesting some kind of chronic infection inflammatory process. She was then re-examined a couple of days later, where it was discovered that she had a clinical mastitis in 1 quarter with associated enlarged lymph nodes. So a presumptive diagnosis of chronic and suppurative bacterial pneumonia with mastitis was made at the time, and it should be said at this stage there was no suspicion or diagnosis of an udder cleft dermatitis lesion at all. She was treated with fairly standard first-line treatment, at least for our practice, with non-steroidals, antibiotics, or rehydration therapy, and then stripping the quarter for the mastitis once it was found. She did reasonably. She got slightly better, so she was kept in the herd for a bit. The milk from the right forequarter did appear normal at 11 days after presentation, but she was still dyspneic with the increased lung sounds. And then at 16 days after presentation, she was then found to be weak with severe bleeding from both nostrils, and she was euthanized for welfare reasons at that stage and submitted for post-mortem. So before I get to her post-mortem, the second cow was a 3.5-year-old second lactation Holstein cow. Again, presented with similar clinical signs of tachycardia, dyspnea, again, left-hand side increased lung sounds. This cow had an active udder cleft dermatitis lesion, which was known about, but again, she was non-pyrexic at initial presentation. She also had a mild normocytic normochromic anemia, with neutrophilia and lymphopenia, again suggesting a chronic inflammatory process. So again, a diagnosis of bacterial pneumonia was made with treatment as per cow 1, but because we started to think about this previous cow, we actually, a few days later, decided to just scan her lungs to try and find if we could see any obvious abscessed lesions. It's probably more to do with our ability to scour an adult cow's lung. We didn't find any abscessated lesions, but we did find some consolidated lung. She was then on day 18 post-presentation found dead in the cubicles, and again submitted this time to show a gross post-mortem through the university post-mortem facilities. So here come the gross pictures. So cow 1, these brown lesions are just multifocal brown abscesses with really nasty, dark, purulent material in it, are found just behind the sternum in this cow. Also, the quarter where the mastitis was, there was also some abscesses with, again, the really nasty, dark-smelling pus in there as well. It's not such a good picture, but there was a small endocarditis lesion on one of her heart valves, suggesting a hematological spread of this infection, whatever it was. And again, the lungs, as expected, had reasonable amount of consolidation, and then, as you can see here, this dark area was then on incision found to be this pretty sizable, again, foul-smelling abscess within the lung, looking very similar to the abscesses found in other parts of the body. These abscesses were cultured, and Providentia stewartii was the major pathogen that was cultured. This is just believed to be an opportunistic pathogen. It's found in sort of dirty water and the like. You can see some of my colleagues who didn't know that. Yeah, so we didn't at the time put this down to be the causative factor. And actually, it should be said that the original post-mortem report, after the original post-mortem report, because we were unaware of previous dermatitis, udder cleft dermatitis lesion, we went looking for possibilities of glass in the sand and something that could have caused a lesion on the underside of this cow. So we hadn't sort of clocked this by now. The second cow did have an udder cleft lesion. Again, the abscesses on the underside of the body wall. This cow had phlebitis around the milk vein, and as you can see, there was some pleural lesions there, pleural adhesions, and an enlarged liver, again suggesting sort of systemic inflammation throughout this cow. So we have seen some other cases since, both from this same farm, and there's some indication of those cows there 4 and 7.5 years, both 3 months into lactation. So not really fresh cows we're not seeing this in. We have subsequently also had a further 5 cases submitted and gone through the post-mortem room at the University of Bristol. And then, like I said, my colleague within the post-mortem room, Mick Miller, got in contact with the expert cattle group in the APHA within the UK. And at the beginning, after the first couple of cases, people were saying no, they hadn't seen this association with the udder cleft lesions and embolic spread. And subsequently, they have been starting to pick this up at other post-mortem facilities throughout the UK now. Whether it's just because we've made this connection and people are looking for it, or whether it's because it's actually increasing in prevalence, I guess that's why I'm here to find out from you guys as well, so we're not sure. So the questions to you, I'll come back to them afterwards, is what is the cause of UCD? We still haven't pinned it down. I guess that's a wider research question. Thinking about why does some, apparently it's been reported 5% of these cases, UCD lesions, will recover spontaneously, but why have these other cows gone on to have embolic spread and abscessation? Maybe anything to do with any of those reasons? And then what treatment, if people are seeing them, what treatments or interventions are they using? Because again, there's nothing sort of in the literature to suggest what is proven to work. We, with our farmers, have started just trying to get the word out there and try to encourage earlier detection, so just making them aware, encouraging them to palpate in front of the udder when they're milking their cows. Maybe I am actually started doing some udder cleft dermatitis lesion scoring with a mirror on a stick when I'm there doing other things in the parlour. I'm talking to our local foot trimmers to try and ask them to point these lesions out to the farmers if they're using tip crushes, and then you can see the underside of cows pretty nicely then. So in conclusion, we think we're finding these septic emboli increasingly through post-mortem facilities across the UK. Hopefully, we're working towards increased awareness with our farmers to work towards an earlier detection of these lesions, because hopefully if you detect them and treat them earlier, you can catch them before they get to this stage. And thinking about monitoring. And the hope is that earlier intervention, appropriate diagnosis would be able to give us a better prognosis or treatment of these animals. And that's it. So I'm just going to flick back and leave it on this questions page and leave it to you guys.